Hydroxyurea, are you any good? A quick explanation of hydroxyurea in the treatment of sickle cell anemia and vaso-occlusive crises. As a disclaimer, this video should be used purely for educational purposes and never for any clinical decision making. So here's a quick overview of the video. First, we're going to go over sickle cell and the disease, the mechanism of action of hydroxyurea and its efficacy, and where Adakveo fits in. So sickle cell anemia is a severe hereditary form of anemia in which a mutated form of hemoglobin distorts the red blood cells into a crescent shape at low oxygen levels. This crescent shape can lead to clumping, which can result in vaso-occlusive crises. Vaso-occlusion leads to slowing of blood flow in the microvasculature, which leads to further deoxygenation and sickling of the red blood cells, propagating the occlusion further. You can think of this almost as like a mini clot. Vaso-occlusive crises can lead to acute chest syndrome, which is the most common cause of death in patients with SCD. So how does hydroxyurea fix this issue? This graph from the New England Journal of Medicine shows the mechanism of sickle cell anemia on the left and how hydroxyurea affects this pathway on the right. First, we see hydroxyurea activating gamma genes, which induces F cell production. This leads to more red blood cells with high levels of fetal hemoglobin. When exposed to deoxygenation, fetal hemoglobin will not sickle. This decreases the likelihood of a vaso-occlusive crisis occurring. How effective is hydroxyurea? In this hydroxyurea clinical trial published in 1995, we found that hydroxyurea has four main benefits. 1. It significantly reduces the median annual rate of pain crises by 55%. 2. Hydroxyurea shows a 50% reduction. But now we have the new kid on the block, Adakveo. This works in an entirely different mechanism of action for sickle cell disease. Time to first crisis and second crisis. However, it may take up to 6 months to be effective. So what concerns do we have with taking this medication? Well, 1, there's a lot of fetal toxicity. 2, we also saw an increased risk of hematologic malignancies, but there's insufficient data to conclude any major risk. 3, we also have seen provider-related barriers related to patient adherence and compliance with the monthly lab monitoring. And 4, lastly, we also see a negative stigma related to hydroxyurea because it was initially used for cancer. Adakveo is a monoclonal antibody that binds to P-selectin, which ultimately blocks the sickled red blood cells, platelets, and endothelium from sticking to each other. Efficacy in the SUSTAIN trial showed a significant reduction in vaso-occlusive crises, placebo rate of 2.9 crises per year versus 1.63 crises per year with Adakveo. Additionally, hospitalization rates in a given year decreased from 6.87 in the placebo group to 4 in the Adakveo group. Adverse reactions were minimal and limited to infusion-related reactions, nausea and vomiting, diarrhea, itching, and chest pain. So the question comes down to which drug is better? Well, 1, from a patient perspective, hydroxyurea is a daily capsule versus Adakveo, a monthly injection. Adherence might be an issue with the capsule, but ultimately this is up to patient preference. 2, hydroxyurea is much cheaper. It's an older medication, which will run about $25 a month versus around $7,000 a month with Adakveo. 3, hydroxyurea does require labs every month when initiating treatment due to known side effects. However, Adakveo doesn't require monitoring, but it still does require the monthly injection at the office. And lastly, hydroxyurea has more concerning side effects. Patients reported the following adverse side effects greater than 30%. Hematologic side effects, gastrointestinal side effects, and anorexia. Additionally, hydroxyurea, as I mentioned, is fetally toxic. With Adakveo, we are really only concerned with infusion-related reactions. The question I'm sure you're all asking is, can they be used in combination? Theoretically, it makes sense because they both have different mechanism of actions. However, results from the SUSTAIN trial have not published the results when they are used together. We'll have to wait to see how Adakveo will be used in the future.